you ever need to rewatch it or share, we encourage you to take a look at the link that we'll be sending out in a follow-up email. We're really excited you can be here, and so Robin's going to introduce the panelists. Sit back and enjoy.
Perfect. Great. Thank you. So thank you very much to everybody who has joined us today. Are you going to put the slide up on the screen? I'm Robin Wittenstein. I'm the CEO here at Denver Health, and the Springboard series is really it's exciting and it's fun. It really is an opportunity for us to bring subject matter experts, people from our community, and have conversation about what really are some important topics that we are working on and directions we're going. So what I'd like to do is introduce the panelists who are going to be participating, and then we'll jump right into the session. Again, if you have questions, please feel free. You can put it in the Q&A. Rachel will be monitoring those and she'll bring them forward. And then we do find that recording the sessions gives people an opportunity later on to ask whatever, to see it and share it with others. So we're really fortunate today. We've got three panelists who are joining me. Bruce Alexander, who is the president and CEO of Vector Bank, and has been a board member at Denver Health in the past, and so has experience not only as a business leader in our community, but also knows Denver Health, knows who we are, what we do, and I think will add some real depth to the conversation around how we can move forward with these kinds of activities. Patty Klinge is a board member at Denver Health now and chairs our Human Resources Committee, has extensive background and knowledge about human resources issues, and particularly human resources as a strategic tool to help advance the goals and objectives of the organization. She's having a little bit of technical difficulty, so I don't think she's on now, but hopefully she'll be able to get connected quickly. And then Helen Young-Hayes, who is the president and CEO of Activate Workforce Solutions. Helen and I ran into each other quite serendipitously and just started talking about economics in Denver and what we were thinking about. And next thing I know, I find out that Denver Health is actually a client of Helen's in her through Activate. And you'll hear more about the kind of work that Activate has done and how that fits into our anchor work and how we're trying to support what Helen is doing and how she is certainly supporting what we're doing. So I'm just going to go through, for those of you who may not be familiar with the concept of an anchor institution, and give you my understanding of what it is and why Denver Health is interested. And then certainly we'll get right into the conversation about workforce. So at its fundamental core, an anchor institution, it's really a simple concept. It says that organizations that are large and place-based, like Denver Health, have the opportunity to commit to economic improvements and opportunities in their communities, and can use their leverage and power to really advance people in the community who are disadvantaged, who need to have help moving out of poverty. And ultimately, being an anchor institution is about helping to end poverty for the people that you serve. So Denver Health, as you know, we've been here, June will be our 161st anniversary, provide clinical care across the entire county, whether it's trauma, services in the ED, physical and behavioral health in the jails, to all of the neighborhood clinics we have. But we see on a regular basis the kinds of social and economic problems and challenges that our patients face at the same time. And so about 2 years ago, we said, we've got lots of different ways that we approach that. How can we have a coordinated and cohesive approach to being an institution that deals with those economic and social risk factors? And so we've adopted the anchor institution framework, and we are going down a path to say, how do we use our economic power through the way we hire, train, promote? How do we use our power in how we spend our money in our community to support local businesses and minority and women-owned businesses? How do we invest our resources, whether it's money or the intellectual capital of the people who work here, to address those social and economic risk factors? And so we've got a program that we're working through to develop ways to do that. And what we want to talk about today is the workforce development piece, the hiring, because I think that's an area where we can really have a significant impact. but it's complicated. There are a lot of issues that the people we could hire and the people we serve face. And I think the expertise of some of the folks on the phone can really help add to the conversation. And my goal actually is to learn a lot from the people who speak, because we've got some ideas, but I know that there is expertise and just ideas that we can pull in and really help to make Denver Health stronger and able to address the things they have. So I'm going to stop there for a second. And I've got a list of questions that I've sent out to the panelists and we can talk about. But I want to give both Bruce and Helen and Patty, if she's on the phone yet, just a chance to jump in if you've got any comments you want to make to start, and then we can just start having a conversation about where do we go with this workforce development idea for Denver Health. So Bruce, can I start with you?
Absolutely, and thank you, Robin. I'm just delighted to be here today. As you know, I'm a huge fan of Denver Health and have been for a long, long time, and I really applaud you for stepping up on this anchor institution concept. For those of us who've been engaged in this, we all have to move beyond just your role in healthcare and really understand the many challenges. I think for me, being in the banking industry, it's been interesting to watch how this whole COVID situation has really exacerbated this problem of the wealth and income inequality within our community. If you look at the unemployment rate, it really impacted those in the lower income areas much more so because of the nature of the jobs they had. That's where the layoffs occurred. That's where salary reductions happened. And so I think this topic becomes even more relevant now on a go-forward basis. I also think so many of us in the business community can learn from you as an anchor institution, and really you all can become a role model for us because we are looking to diversify our workforce. We're learning to try to connect with the communities that you serve. So I think this can have a huge value add of benefit for Denver Health in the way you operate. But I think you can be a convener, a bringer, someone who brings together all the various groups, and that's business, it's nonprofit, it's healthcare, it's philanthropic entities, and as we all educate each other about how do we meet these challenges, I just think it's a great opportunity. So great work on Denver Health's behalf, starting a plan like this.
Thank you, and I fully expect we're going to learn as much from you and your team as you're going to learn from us. So, Helen, do you want to say a few words before we jump into questions?
Yes, I'd be happy to. Thanks for having me today, Robin. Excited about the opportunity to share and to learn. I am such a big fan of the anchor institution model for one reason, and that is because you take a holistic look at the health of individuals. And we are focused on workforce development at Activate. We do two things, and we do two things really well. We help identify individuals who are serious about wanting to succeed economically, to become self-sufficient, and then to succeed professionally. And so we connect individuals who are humble, hungry, and smart with the type of opportunities, the transformative opportunities in career roles at organizations like Denver Health. When I met Robin about 2 years ago, we were just getting to know one another, and Robin said, you know, my passion, my ambition is to end poverty for people in Denver. And I said, wow, that makes two of us. That is exactly why I started Activate. And so we help individuals end poverty and end the cycle through connecting them with full-time, full benefit careers. And then after we connect them with these opportunities, we coach them to success so that they can acquire and master those habits, mindsets, and disciplines that will catapult them to long-term success professionally, with life skills as well as personal financial skills. And so it is understanding that getting someone a job is the first step, but helping them become transformed with the skills that are necessary to become economically and professionally mobile. This is the continuum that we serve, and that helps us move people from poverty to self-sufficiency. At Denver Health, I was just looking at our numbers. We take individuals who on average were earning $8,300 a year before we introduce them to Denver Health. And we place them into over $35,000 a year roles. Healthcare insurance, medical insurance adds another $12,000 to $20,000 in those benefits. And so you can see that we have quadrupled people's incomes, but more importantly, through the dignity of work and through this new opportunity and through the community of work, through the community of Denver Health, we're actually able to really transform lives for second generational impact. And I'll talk more about that later.
Excellent. So, and Rachel, Patty has, okay, perfect. So, you know, one of the things that that I'm really interested in is, you know, there are a lot of programs out in our community that deal with different pieces of this. There's job training, there's job placement, there's all kinds of things. You know, I guess the question is the vision that we have for what Denver Health as an anchor institution can do, and even the vision for workforce development within that is pretty broad. I think one of the questions I have, and I would love to have a conversation around, is how do we reconcile a vision of Denver Health as an anchor institution leading away across this very broad book of work with the fact that there are so many pieces that exist? How can we, you know, how do we avoid duplicating? How do we bring things in and make the connection so that we don't have people being forced to go from one place to the next place? I think one of the frustrations I hear a lot is how hard it is to understand what's out there, how difficult it can be to navigate through. But at the same time, I want to, you know, I'm really concerned that we don't duplicate, that we don't, you know, just add one more layer of complexity. What might your thoughts be? Because you both know Denver well.
You know, I think it's a fascinating question. We as a financial institution get asked all the time to support various programs, whether it's housing programs or other social programs. And it's difficult for us to understand, you know, who is the best, how do we avoid the same kind of duplication that you're talking about. And when you add all the elements that you're trying to touch in a holistic approach like this, whether it's job training, whether it's housing, whether it's a job, whether it's continuing education, financial education, there are just so many component parts. And so one of the things we've tried to do at the bank is to look at each one of these categories and make a list of all the housing providers and make a list of the particular social service agencies that target some of our mission, and really study them and prioritize who's the best and who should we support. Again, I think you, for yourselves as well as for the rest of the community, could really help in that inventorying process, if you will, right? And as a bank, where should we be supporting? I also sit on the board of the Denver Housing Authority, and I listened to your first Springboard series, which was just so fascinating. But how do we complement the work that you're doing? And so I think one of the first things that you can do as an anchor institution in this space is to maybe make a matrix of who are all the players in the particular categories that they serve, and then create a dialogue, not only amongst yourselves, but with other philanthropic organizations, with other business communities. I know that, for example, the Denver Metro Chamber is trying to address this same kind of thing. You and I have talked about that with Kelly Bruff. And so I think that convening role and helping us all kind of identify those priorities and where we can play best would be a great starting point.
Interesting. Well, and I think, you know, I've shared a little bit, I don't know, Helen, if I shared with you, one of the things that I asked our board to do when we kind of started down this path, and absent COVID threw a lot of things up in the air, obviously, but if we are going to adopt this anchor institution framework, it really means that we begin to think about ourselves differently, we invest differently, we hold ourselves to different measures of success. And so I have asked the board to have a board committee that really is vested in being involved in oversighting this. And so, and they agreed. So we have a community engagement committee, and it's got, I can't remember if it's 2 or 3 board members, but there are a lot of community organizations that we have asked to be members of this committee. And part of the work for the committee over the next several months is really looking at, if we're going to do, you know, if we're going to really advance this workforce development, for example, I agree, Helen. It's not just give somebody a job and hope for the best. It's bring them in, but then do all of the things that are necessary to help them be successful, including the things that are the work and life supports like childcare and housing and all of those things that can cause somebody to not be able to be successful. And so part of the work of the committee is really to look at who's out there and who might be partners. Not to say that there aren't others as well, but it really, I think Bruce gets to that. We can't partner with everybody. So who is best aligned with us, the mission and the culture and the values that are similar. So I do think that's important. You know, Helen, thinking about Activate in particular, and we think it's a phenomenal program, and I tell everybody about Activate. I use it as one of our success stories. But one of the things that I think we're looking at is how do we also then make sure that for people, and I like your, the lights just went out for some reason. Okay, we have to move around a little bit. Humble, hungry, and smart. I like that. But you know, there are people out there who are humble and hungry and smart, but they don't quite make it into a program like Activate. I mean, Scott, you know, what are the ways that we can make sure without, and we're not sitting here saying we're trying to save the world. I mean, there's a mutual responsibility, but how do we make sure that we can be more inclusive of people who may not quite be ready for the program that is Activate? And I'm sure you've thought about this.
Well, I have thought about it. So what individuals who are experiencing poverty lack is a combination of education and skills as well as access. And so I think that improving the accessibility of certain roles for individuals at Denver Health will enable more individuals to actually apply to and succeed. So, for example, we have an individual who moved to the U.S. from Mexico. He got his high school diploma in Mexico. And he actually has a couple of years of an art degree here in the U.S. He doesn't have his physical transcript, and he needs that to work at Denver Health. And so, and he would love to come on as a custodian. He would love to come on as whatever. But, you know, there are certain requirements that I think exclude individuals unintentionally. And so I would say that removing barriers to employment is something that all employers should be actively doing. I'm a big fan of taking away that four-year college degree requirement, and you do not use that at Denver Health except in the skill sets where you need, for example, nurses or doctors. But you know, so removing those educational requirements and moving more towards skill and competency-based hiring is helpful. One of the areas that I really applaud Denver Health in is that you will look at individuals who are justice involved. And so you do that on a case-by-case basis where appropriate. But if someone has a DUI that's 7 years old and has been sober for 6+ years, you don't automatically exclude them given their criminal background. And so I would say that that's one of the ways that you have already lowered barriers to employment. But I would say that for any organization, really important to understand where the barriers come. For example, resumes. If you have a white sounding name on a resume compared to a black sounding name, you're James versus Jamal, the white individual is going to get called back at 2.5 times the rate of the equivalent candidate with a black sounding name. And so looking at you know, blind resumes, taking out the names, because there is hiring bias, there is gender bias across America. And so lowering the barriers, increasing access, and then also providing skills. Upskilling is very important. And I know that this is an area of tremendous for you. But getting someone in the door at that entry level is not going to end poverty for people, but providing them with the opportunity, the skill path to move from a custodian into supplies and logistics, and then ultimately into an EMT position, which, you know, the young man who was featured on KVDR with as an Activate placement at Denver Health, you know, his life has been transformed by his job. We placed an individual just recently who, 26-year-old young man, moved here from California, African American, and hard worker, was at the Amazon warehouse, but didn't make enough money, couldn't afford Denver. And so he checked into the Denver Rescue Mission before he became homeless. We connected him with a role as a custodian. He took anything he could get because he wanted to be at Denver Health. And he earned a Heart Award recently because he's been working so hard. And so he's already planning his next career path move. But these are the types of opportunities that Denver Health provides, which is you're a city, you're a very, very large employer, many pathways of opportunity, and consciously helping your individual find those opportunities for upskilling is something that we need in our economy very desperately.
Well, and one of the things, and Bruce and I had a chance to talk about this just a little bit, but there are a lot of opportunities at Denver Health, but and we have our share of problems. And I will tell people we are not fundamentally. I'm sorry, we're having a little technical there. We're not fundamentally different, having some of the same problems that everybody else has. But I'm hoping that one of the differences is we're gonna look in the mirror and be our own worst critic to try to advance us. But one of the things that I'm trying to figure out how we can do effectively is how we can be part of or create a bigger ecosystem that can help to solve these, and the connection to the business community, and what is the best way, or maybe just one way, that we can partner with the business community more effectively, so that what we do here is helpful and can advance our goals, but that it's not just about Denver Health's goals, it's about the city's goals. And Bruce, you and I had a chance to talk about that a little bit, and I'm sure you've thought about it more, but what are some ideas about how we work more with other members of the Denver community to be able to really give more opportunity?
Well, one of the benefits of this past year is I think we as a society, we as a business community are much more self-aware. We understand that we have some of these unconscious bias. We don't know what we don't know about what these opportunities are. So I really think you guys can be a role model for the business community. And I love what Helen just said, that it's education, skills, and access, right? And so if you look at an industry like ours, we have a certain skill requirement, but we don't do anything early on to provide that skills training to some of these communities of color. So if we could work with other organizations to identify what those skills are, and with you, and actually provide earlier intervention, earlier skills training, I think that could make a big difference. And it's a financial literacy, but it's also, we're in the customer service business, and so it's connecting on those life skills. What are the things that are a priority? And I think we want to do that because we need that workforce. We want our workforce to reflect the community. And so if 25% of the community is Latino, we want to have 25% at least of our workforce to be Latino. And so we need access to those communities just like they need access to us. So another thing I think you can do is help provide that access to us. We want to go communicate with Black churches, with Latino chambers, with other organizations that can create that kind of access that Helen was talking about. And so I think really focusing less on the college degree, I agree, Helen, focusing on the skill set and then helping create those connections and that access, I think you'd find the business community would be wildly supportive of building those kind of partnerships. Do you agree with that, Helen?
Yes, I do. As a matter of fact, I think Denver Health as a role model, and even elevating the conversation to extend beyond the conversation about income and employment, but to look at the various reasons why people are trapped in poverty, including transportation, housing, education, upskilling, training, et cetera, and connecting with the broader business community and educating them as to holistic solutions is a role that Denver Health could provide. I'll just brag on Robin for a second. Robin is a part of our Colorado Inclusive Economy movement, which we launched last year. It's a movement of CEOs to rebuild with racial equity, diversity, and inclusion as a goal and not as an afterthought. And Robin shared her Denver Health's very, very thoughtful, comprehensive strategy for achieving equity, inclusion, and diversity within the workforce. And all of the CEOs asked for a copy of this because they wanted to replicate in the ways that they could the Denver Health Plan for equity, inclusion, and diversity. And so already I think that there has been a ripple effect of the very thoughtful way that Denver Health and Robin and leadership have looked at the issues that challenge our community today of economic inequity and persistent poverty, and looking at how even incorporating what I feel is the highest form of philanthropy, which is giving someone the opportunity to care for themselves and care for their families through a life-giving career in an employment situation, is one of the real ways that Denver Health is lighting the way. I can't stress enough that we have an urgent issue at hand that the pandemic has accelerated, and that is inequitable skills acquisition among people of color. And so we all know that the job losses have occurred in communities of color. We know that the skills deficit, the educational gap, even from high school attainment, which persists then and widens into a four-year college and post-secondary educational attainment. These are gaps of skills, 21st century skills, that if we are not about skilling up our workforce as rapidly as possible, we're going to have even worse poverty and inequity than we have experienced to date, given the changes in the workforce and the digitization and the obsolescence of jobs. And so providing these career pathways, CNA moving to licensed an LPN, or moving to an RN, or medical admins moving up, and providing that essential skilling and training for individuals. This is something that we should all be about. All of us as CEOs should think very carefully about how can we get the 21st century skills of the future into the hands of our underserved populations as quickly as possible. And that could be through youth apprenticeship models. It could be through collegiate fellowship and internship models. It could be through creating alternate pathways. But we need to skill up our individuals who are being left behind.
You know, it's interesting. I had a conversation recently with someone, and I think one of the things that, and this is broadly all of us together, this is what we need to do. But I also think we have to start thinking about how do we take these conversations and really blow them up so that we're actually getting at some of the long-standing issues that are creating people who don't have the skills, et cetera. So, and this comes to mind because I was talking to somebody about early childhood education, you know, pre-K and kindergarten, and the importance of that, not just because of the educational implications, but because of the way that a lack of school readiness leads to a pathway that leads into the criminal justice system, and really thinking about these different components as all, it's a spider web. It truly is a spider web. You can't point to something and make changes and think that's going to be sufficient unto itself. It's really got to be, you know, we've got to be willing to tackle the criminal justice system and the disproportionate number of people of color who are caught up into that may very well have its roots back in, you know, pre-K that doesn't serve the needs. And sometimes that's hard because I think there is a tendency to see it as if we're being incredibly critical. And in fact, it is just the situation. And the question becomes, how do we address it? I do want to take a second. Patty has joined us, so she's on the phone. And Patty, why don't I give you a minute? Is Patty unmuted?
Patty, are you there?
Yep, I'm here.
Okay, Patty, and I'm not sure exactly where you came in, but if you want to just take a minute and sort of introduce yourself, and then I have a specific question for you, because sitting as a member of our board, and in particular with your background, I guess my question to you would be, why is this concept of an anchor institution meaningful to you? Why do you think that it, going back to a question we've had before, why do you think it's meaningful to you personally, to the board, to the organization? Why do we have any reason to believe that it is going to stick and that it will be doing this 10 or 20 years from now?
Well, thanks, Robin. I'm so sorry, everyone, that I was not able to get on WebEx today for some reason. So I'm Patty Clinge. I've been on the board for a couple of years now, and my background from a professional perspective is human resources in large corporations, and also I'm a psychotherapist by training as well. But I've been very involved in the Denver community and nonprofits for the last, I would say, almost 2 decades. I've been extremely involved since about 2000. And to go to Robin's comment, I'm going to kind of start at the basics, but because we know that the social determinants of health are so significant, that these are heavily responsible for healthcare issues and inequities, that if we don't address those, and that certainly includes economic security, if we don't begin to address those more effectively, Denver Health can't really achieve its mission of trying to transform the health of our patients. I mean, there's just no way, if we don't address some of these social determinants, we're just going to see people over and over again. And the chances are their physical and potentially behavioral health condition will worsen if they continue to have to be challenged by such extreme social issues and poverty. So I feel like our commitment to an anchor institution is absolutely, it's of great import in order for us to achieve our mission, that we really want to reduce economic inequality in our community, and that we can do that if we really partner well with other nonprofits and business institutions, and also if we provide wraparound services. There's a lot of evidence that if you don't provide the support for, particularly for employment, if you don't provide wraparound support, that it's really difficult for people who start in a one-down role to be successful. There are just too many roadblocks, too many things to trip over. So I really believe strongly in this concept, and I think it's one that once we start it and build really good, and we've already done some of these things to build really good partnerships, for example, with Helen and her organization, that will be successful. So I feel like it can be a long-term commitment and will be a long-term commitment on the part of the board. And my experience is the whole board is very, very interested in this and very committed and understands how significant it is to our achieving our mission ultimately.
Well, one of the things that I sometimes, when I lay awake at night and figure out, what are the things that kind of keep me up at night. One of the things is, especially with what's going on in the world around us today, the economy is going to be a mess for a while. It's just going to take time for everybody to recover. In order to do the things that we need to do to help provide the wraparound services, the ability to do the training and the education, the development that give people not only a job, but the dignity of a career, of an opportunity to grow and develop. I believe everybody wants to have the dignity of being able to support themselves and their families and do the things for them that any of us want to do. The question is, how do we, as an organization and as a community, how do we make the investments that are necessary and that are needed, given the economics of the world around us? I mean, for those of you who know Denver Health, I would say there's two things that are both true, even though they sound like they might not both be able to be true at the same time. One is we are a safety net institution. So, you know, if you exclude our own employees, 90% of the patients we take care of are either uninsured, Medicaid, or Medicare. And the federal government's payment systems are designed to pay you less than the cost of care. So you spend $1, you get less. You spend a little less than that, and they'll give you a little bit less. So it's just a really interesting business model that I don't see everybody else trying to replicate. So we are, that's who we are. But at the same time, the other piece of Denver Health that is just as true is that we don't let that lack of resources stop us from doing what we have to do. And the organization, it's been here for almost 161 years, continues to be able to try to make progress, but it is a challenge. And so the question is, how do we figure out as a community how we can do these things so that not only can people come to Denver Health and be gainfully employed and have opportunity, but go off to Vectra Bank and have the same opportunity. And is this the right time to do that with what we've got economically in front of us? And I'm just not sure what the answer to that is. I know, Bruce, you are deeply involved in the economics of the world around us. What are your thoughts on that?
You know, I think if anything, now is absolutely the right time. And again, back to this role of you being a role model, a leader, a convener. I just think what a great opportunity to provide that leadership, but then have other people see the value add that you bring to the table, which ought to help bring you resources. So a specific example, if you look at housing, you know, clearly that's a huge need here. I know that you have a partnership with the Denver Housing Authority and you're working in concert with them. But think about it also about the other ways that that gets supported. So there's the philanthropic community and reaching out to them and coordinating what their role is vis-a-vis your role, vis-a-vis DHA, I think is really important. But then coming back to the business community and how bankers and others can ensure that they're helping to bring capital to solve that problem. You can't do it by yourself. We can't do it by ourselves. But if all of us, again, that role model of bringing people together and determining what is the role of the philanthropic community and foundations and versus your role versus DHA versus the business community. I mean, I think there's real opportunity, and it still goes back to that skills and access thing that Helen was talking about. One other point I want to bring in that I think is really relevant. A lot of people, if you look at what's happening in the economy right now, low-income populations have struggled, but those who make maybe more than $70,000 a year are saving a ton of money. There's like $1.7 trillion of savings out there that's waiting for a pent-up demand for the COVID experience to be behind us. What a lot of economists say is that that's going to create an explosive recovery as early as the fourth quarter of this year. Stock market's doing well, donors have money. I do think this is an incredible time to step up. So I would strongly encourage you to continue down this path and continue to be a convener of all those different communities, because I think it will really leverage what you're doing.
Well, that's encouraging, actually. Although, you know, again, and I tend to be very data driven, and I think what we're talking about is really important, and it feels good, and it will do good. But one of the things that I want to be able to do anytime I'm standing in front of a group of people and talking is say, here's how we know. Here's how we know that a dollar that's been invested, whether it's through philanthropy or grants or operating dollars, here's how we know that we are achieving something that is meaningful both to the individual, but also to the broader community. And so part of what we're looking at is what ought be the measures of success. Helen, I think ultimately eliminating poverty is the key measure. But, you know, what, from the perspective of people who are working in the community, what do we need to do in order to be able to say it is worth being part of this because of the impact? What are the things that you would be looking for to say this is just great and it really is what we want to see?
I would like to see us as a community address the educational attainment gap. If you look at the 8th grade math proficiency rates, for example, in Colorado, 63% of Asians have 8th grade math proficiency, 48% of whites, 19% of Latinos, and 18% of Blacks. And so you can see already that if 18 to 19% of Blacks and Latinos have an 8th grade math proficiency, 80% do not. What does the lack of math proficiency translate into in terms of long-term earnings outcomes? Similarly, if you look at the high school graduation rates, again, high school graduation, 96% of whites are graduating from high school, 87% of Asians, 90% of Blacks, and only 70% of Latinos. And so right at high school, we've lost 30% of Latinos who don't possess the basic educational requirements to meet most jobs. And so I think if we could level the educational gap, we would do a lot to then reduce the subsequent inequities that result in poverty. So leveling education, I think, should be a focus of ours. And in my opinion, that would be a real success if we could point to that as a community. Other areas of success would be in granting that work experience, and all important, like first job experience, and then looking at the experience, even among entry-level talents, of what are the skills and competencies that they are acquiring, and what would we like them to acquire, rather than having them churn out at rapid rates, but actually build into the first year of employment experience. What are the competencies that we would like them to get out of this first opportunity, and how do we build that in, and how do we measure that, and how do we then reward the advancement of that? And so building in more competencies into those entry-level roles, but particularly educational attainment.
You know, one of the things I would add, Robin, that as a bank I'm really sensitive to is small business ownership. As a bank, we're really paying attention to, do minority-owned businesses really have access to capital? Do they have access to the skills and training to start their own businesses? One of the ways to really address the wealth gap versus the income gap is to encourage the creation of entrepreneurship among minority-owned businesses. And so we really see that as a great opportunity that you could help us with, is to identify how do we create those jobs? How do we ensure that financial institutions, community development financial institutions, and other equity sources can really invest in these companies so that they can create wealth and also create jobs? And so this doesn't mean just working for big employers. 95% of the jobs in this state are small business, you know, under 25 employees. And so I think helping to invest in that. You were telling me about some of the great products and things that have come out of some of your own employees. And could we encourage companies to help invest in those kinds of small businesses that could be created out of their own infrastructure? I think that could be really exciting. And it's a way that you could measure the investment, you could measure the creation of incremental jobs, and you could measure the creation of wealth by the individuals that own those businesses. So I think there's a great opportunity there.
Well, you probably will both be surprised, but as each of you were talking, I've got ideas. I've got some ideas in both of those spaces that I would love to have additional conversation with you around. Patty, your thoughts? Because again, as a board member, the fiduciary responsibility for the organization rests on your shoulders. You know, your thoughts on this?
Yeah, I think that, you know, in the end, employment is what is most significant, and there's no question about that. And I think we can make a direct contribution and help ourselves and help people who are in need of employment and move them through the employment ranks. And I think a measurement around that is going to be retention and wage progression. You were asking about measures earlier, Robin. And if we can track that carefully, that's going to be really important. I think it's going to be important, too, to try to communicate. This is always hard from a nonprofit side, but to try to communicate to the community and prove to the community that by doing this work and doing it well and getting people into employment, into entrepreneurial activities, providing child care, helping them with housing, that in the long run, the cost to the community would be sufficiently reduced. that there's a lot of cost in having the amount of poverty that we have in terms of all of the systems that have to support that, whether it's human services systems or, in many cases, unfortunately, jail systems and so on, that if we could communicate that and prove that through data, that would be a big start. And in terms of our being able to do that as an organization, I think I'll just be candid and say I think some fundraising is going to be absolutely essential, and partnering and having co-investment with some of our partners to achieve these kind of outcomes. But I think it's going to be essential to have that in order to be able to move this forward, except in very small ways.
Thank you, I appreciate it. And I agree with you about the cost to the community. I will also add, though, having had conversations with some of the people who have come to work at Denver Health who, come from difficult backgrounds, and just hearing the stories of what people have gone through and the challenges they faced, and sometimes even having given up hope, but now seeing that there's a path forward. There's a cost in terms of all of the social services, the criminal justice system, all of that. But the cost in the human capital that is wasted. And we just are not giving people the opportunity to truly be who they are and make the greatest contribution, not only to their family, but to our society. When I talk to some of the folks who have come through, whether it's Activate or Emily Griffith or some of the other programs, our own pharmacy tech program, and just hear the stories and hear what people see for themselves in the future because they now have the opportunity to envision a different future. That alone, even if we didn't get any other benefit, is actually amazing. And to see people's eyes light up and the smiles on their faces, and to hear them say, I know how I'm going to feed my kid tonight. And that is just a value that we get as a society that I think sometimes it's hard to put a dollar amount on, but it is clearly something that not a single person who listens to this would say isn't worth doing whatever we need to do to get to. So I really appreciate it. We're a little bit over time. This has been really good. I do have some new ideas that have come out of this, so I'm probably going to be reaching out to both of you with some things that I think we can do. And again, I appreciate this because it continues to give us input and different ways of looking at the issues. The lenses we each have are different, and it's helping to make what we're planning and what we're doing more robust. And the workforce development piece in particular, we're going to be rolling out a much bigger program that's designed to get at a lot of these issues, learning off of what we've learned from Activate, the Colorado Inclusive Economy, the work that we're doing there, and we're committing to making that really public and transparent and having the conversations we need to have. I think there's just a huge amount that we can do, and I hope that people will feel free to continue to push on us and maybe to push us to do more or to think about things differently. So again, thank you so much to both, to Helen and to Bruce and to Patty for participating, and thank you to those of you who have participated. I didn't even stop to ask for questions because we were talking so much. I'm sure we have some questions.
There are, if our panelists want to stay a couple extra minutes.
Can you just give us 5 minutes? So I completely forgot to ask for questions. So Rachel, go ahead.
So, one was a comment. Not only do we have to upskill today's low-skill workforce, but we need to reverse engineer job skills into our education system so the next generation of our workforce is well prepared.
Yeah, that's a really good conversation, a good comment. And I have said to many people, I think one of the things that as a country we made a mistake in doing is we sort of got this picture of the American dream in our head. That was, the suburban house with the white picket fence and everybody goes off to college. And that's great for some people in some ways, but there's lots of other ways to do things and be successful and have a happy and full life. And I think we've lost a little bit of that. And we have to kind of bring some of that back.
Another is also a comment. As part of the necessary skills, children need to understand life skills much earlier so that they can identify and pursue possibilities that appeal to them with a purpose.
Yes. Actually, that comes to the idea I have about around the educational team, and I've got an idea on something Denver Health might be able to help with.
All right, so this one is a question. You referenced earlier the necessity of wraparound services to support the harder to employ. How is Denver Health affording that, and/or are you working with other partners?
So the answer is we don't know yet exactly how we're going to afford it. We are going to work with other partners. I think when we think about things like housing, for example, the Denver Housing Authority is a phenomenal partner, but I've also had conversations with Elevate Land Trust. I actually think that when we think about building wealth in this country, it has been tied to business ownership, but it's also been tied to home ownership. And there are many people at low income levels who have never had an opportunity to own a home, and they don't have the chance, especially over generations, to build that wealth. But there are organizations out there that do this and that we can partner with to help. We are going to have to invest some money in some of these things, and we are working on it. As Patty said, some of it will be through philanthropy, some of it will be grants, some of it will just be rolling up our sleeves and finding extra coins in the sofa cushions and figuring out how to spend that better.
Robin, can I add something to the wraparound services question?
Of course.
I think what the kind of work that we are doing is trying to understand, and we're starting with our own patients, of course, but trying to understand what are the list of issues that they're dealing with that are more associated with their social, economic situation, and then trying to partner with organizations and make referrals to organizations to provide more wraparound services. But that needs to be a lot more robust, and we're just beginning to work that so that it becomes more of a closed system so that we can in a way do a case, and I'm not saying we necessarily, it would be Denver Health, but either Denver Health or through partnerships, do a case management so that we're not working on one thing and another thing goes off the cliff. So I think it's going to be important to understand that we might need to work on housing and child care and maybe some behavioral health issues. I mean, there could be some combination that I think we can be a connector of and try to figure out how do we do that in a case management way so that we really are providing wraparound services.
Yeah, I think that's a really good point, and it is true. And we've seen that happen even inside the organization, and Helen has had some experience with it where somebody comes in and everything's going along and then something starts to go wrong. You can deal with that, but two other things happen at the same time, and it just becomes impossible for somebody under that degree of stress and trying to deal with the day-to-day to handle all of that. So I do think that that kind of case management and referral management is really going to be critical. So again, I am aware of the time, and I don't want to keep people beyond when we promised, but thank you so much. Thank you, Patty and Helen and Bruce. This has really been useful, and I've taken a whole bunch of notes as we go, so I appreciate it. If anybody who is on the phone has any additional questions or would like any more information, please feel free to reach out to me directly, and I'm happy to answer those questions or connect you to people who can answer them better than I can. So thank you again so much, and we really appreciate the interest. And more importantly, I know Denver is unique. People who live in Denver actually care about these issues in ways that you don't see in a lot of other places. And I am really grateful that we can have these conversations and get this input. So thank you so much. Bye.
Thank you. Bye-bye.
Bye.